I think we need to make more noise about menopause and increase menopause awareness in women. All women will go through menopause. It is a time when their periods will actually stop. And that is really significant because there are two main hormones that make that woman tick, which is the estrogen and the progesterone. And when menopause occurs, both the estrogen and progesterone levels really come down. And for women, this is really important because estrogen keeps us well. It keeps the brain functioning, it keeps the heart functioning, it makes sure that we digest well, we think well, we look well. Our bones are much stronger, our vaginal health is much better, our uterus and ovaries work well. So when all this starts slowing down, women can run into problems. Now we know that menopause in this country occurs on an average at about maybe 50 to 51 years. And we also know that the life expectancy in a woman now is beyond the age of 75. That means on an average, a woman would spend 1/3 of her life in the menopause. Become very significant because women now want to live healthily. They are working, they are going on holidays, they are taking the car and driving around and running errands, and they want to continuously do that and be well mentally, physically till the end of their days. And so without that estrogen, things may become a problem. Now, not everyone needs a replacement. Some women do, some women don't. Some women have a lot of symptoms when they go through the menopause. They may have things like hot flushes. That means suddenly feeling really hot over the chest wall and the face. Or they might feel that, when they're sleeping at night, they wake up really sweaty, and that disturbs that sleep pattern. It makes them wake up crankily, they get very tired, there's a lot of brain fog, they don't function like they used to do, a lot of joint pains, feeling moody, feeling really exhausted. Even their heartbeat can be much faster, and this is what we call palpitations. Their digestive system goes out of whack, they get very bloated. So these things can affect a woman because then she feels that she's not like what she was before, and her quality of life comes down. Now, these women are women that we actually talk to them about replacing their hormones to make them feel better. Now, replacing their hormones would also work as a whole, would make their heart much healthier, would make their bones much healthier, would make their brain much healthier. And we do talk about the fact that dementia in women is actually much more common as they age. So overall, menopause is a really important part of a woman's life, and being prepared for it and knowing a lot about it, being aware about it, and knowing that there are things that we can do, and not only, not necessarily with medication, but lifestyle changes, what are the tests that they would go for, is really important, and we need to promote them because we want to keep these women really very well and healthy. So when a woman goes through the menopause and she's feeling really not herself, it's very important for that support system around her to recognize it and to help her get help. Now, her family is really very important. So, of course, the partner, or if she's not married, the family around her, it could be her brothers, sisters, even her children, even her elderly parents who might find that that woman is not the same as she was. And she might be trying to hold everything in and not letting it out. And so taking her for a general checkup, taking her to see her gynecologist might actually work to her favor and make her feel a lot better. Now, we are also talking about women who are getting older at their workplace. And this is something that's called menopause at work. And that's become a real big thing out there now. About 40% of women actually feel that their menopausal symptoms are so severe that it is actually interfering with their quality of work. And so they're not able to put in that much as they used to do before. And surprisingly, about 1 in 10 women actually put in their resignation papers because they feel that they're not up to par. They feel really low about their work performance, and they actually leave work because of their symptoms. And this shouldn't be, because these women can get help and still be as productive and be as good as what they were before. So this is really an area that we really need to look at, and especially for women's health. Now, when women in the menopause, or rather every woman, I always like to encourage all my women, whether they are going into menopause or not, that a regular yearly checkup with their doctor is very important. And it can be even a general practitioner, or it could be their cardiologist, it could be their gynecologist, but coming in and just talking about how they have been feeling the year before, it is very important, because we can pick up certain things from, what has been different from the previous year. And knowing about family history, which is also really important, because genetics you can't change. So knowing that, let's say she comes in from a family of heart disease or diabetes or blood pressure, then we know that as that woman ages, these are the areas that we need to look at. Or if there is a strong family history of breast cancer, then we know that we need to start her mammograms or breast ultrasounds at an earlier age. So knowing that genetic background makes it easier for us to know to tailor-make tests for her as she gets older. So now, everyone is sometimes scared about doing tests, but tests are important, because what we're looking at is not tests at that results at that particular point. We are actually looking at results that change along the years. So today's blood test may be very different from blood tests 2 years down the line. And we know that there is a change, we can address that change. Mammograms today might be normal, but in 2 years' time might be a bit different. And then we know that we need to pick up on that and then check on her a little bit more better. So these tests are really important as a woman gets older. So the history becomes really important. Change of investigations along the years become really important. And what that woman is telling you about how she is feeling in that last 1 year since her last checkup also becomes very important in how we would then organize certain tests. With menopause and when the hormones are changing, a woman can go through a lot of swings in her mood. And this can also be exaggerated by the fact that she's not sleeping, she's tired, she's having palpitations, and a lot of other things. Now, these mood swings can be quite intensive, and it can change that whole personality of that woman. At the back of her mind is the fact that she knows that she's going through hormonal changes, and everyone talks negatively about menopause when actually they shouldn't. And she then starts feeling that she is actually aging, and it can be quite an emotional time for that woman. And putting all that together with the fact that she may also feel that she's not performing well at work, or not being her normal self at home, can actually make her feel really down. And it is very important for us to normalize menopause, to make it seem as if it is a normal phase in a woman's life. And if she needs help, she can get help. And that's very important for us to emphasize. It should not be seen as a negative time in one's life. It should be actually seen as a fact that you're moving on from one era to another era, and in a positive light. You are actually maturing, and you're going on to a phase where, yes, there are no more periods, but you are now going on to a phase where you can enjoy life without periods. You are actually at a point where probably at the peak of your career, or you are then contemplating retirement or relaxation therapies coming in. Children might have already left the house or already studying. So looking at it from a completely different angle, and at the same time having that support system around you that if you know that if you need help, they can actually bring you in to get some help, and you then accepting that help and then moving on from there. It's very, very important, because I always find with my patients that when they always come in very fearful, "Oh, doctor, is this menopause?" And I say, yes, so if it is menopause, it's fine. It is, let's just think positively about it. And if you need help, we then get you that help that you need.